Fever is one of the most common medical complaints of childhood. Almost all children develop an elevated body temperature several times per year. In most cases, the source of the fever is obvious. That is, there's cough and congestion to suggest a cold, or a red swollen patch of skin to suggest a bacterial soft tissue infection. In some cases, fever may be the only sign of an impending, serious, or even life-threatening condition. Fever is a symptom of disease and by itself is rarely dangerous unless it is more than about 105 degrees Fahrenheit. It is your pediatrician's job to determine when fever should be evaluated with expensive and invasive tests such as blood draws, spinal taps, or imaging studies. Body temperature varies slightly throughout the day and from person to person. The most commonly accepted value for fever is 38 degrees Celsius or 100.4 degrees Fahrenheit or above. The best way to measure body temperature in young children is with a rectal thermometer or an oral thermometer in older kids. Thermometers that you put in your ear, on the skin, or under the armpit are not very accurate. The most important goal of evaluating fever is to determine the source. Young children may not be able to point to a source of pain or describe how sick they feel. All infants less than 6 months of age with an elevated temperature or established fever should see a doctor, and all infants less than 1 month of age should be admitted to the hospital. Any child that appears unusually sick, is not drinking fluids well, has a seizure, has a rash, or is acting unusual or is difficult to arouse should see a doctor immediately. In older children, fever can be treated with ibuprofen and/or Tylenol. However, parents should not feel like they have to fight the fever because fever actually helps the body fight infection. The main reason to treat fever is to make the child feel better, and a child that feels better is more likely to drink adequate fluids, preventing dehydration. So talk to your doctor regarding your specific case. I'm Dr. Michael Davis. For more information on this and other kids' health topics, please visit healthykidtips.com.